Welcome to my video on Autism Spectrum Disorder, or ASD. The topic I'm going to cover today is the importance of early identification and diagnosis. Parents and educators should seek assessment as soon as signs become evident. Early symptoms of ASD may become noticeable between 12 and 18 months of age, or even sooner, depending on their severity. Unfortunately, early identification is sometimes delayed. Reasons for this include symptom severity, gender, culture, and attitudes towards diagnosis. Some early symptoms of ASD that are often overlooked are not initiating conversations, lack of desire to socialize, and little to no eye contact. Gender also plays a significant role in early diagnosis. Boys are documented as being diagnosed at 4 times the rate of girls, while girls with autism are often overlooked as shy or less outgoing. Non-Western cultures may have different expectations of how children should behave. Most diagnostic tests were developed in Europe and the US and are based on Western cultural norms. Some Japanese parents perceive a child's disinterest in peers as shyness or modesty, valued traits in that culture rather than a red flag for autism. Attitudes towards ASD can also hinder a diagnosis. Parents may be worried about a negative stigma attached to autism and fear that life with a special needs child may present overwhelming challenges they weren't prepared for. So who should your child see first for an initial autism assessment? Your child's pediatrician should be your first stop for assessment. Follow-up diagnostic testing can also be provided by a neurologist, psychologist, and psychiatrist if necessary. It is most important to find specialists who have both knowledge and experience in assessing for autism. So what's covered in a comprehensive assessment? The assessment should cover communication abilities, socialization skills, any repetitive behaviors, how your child performs academically, and the presence or lack of eye contact with others. The evaluation should also include the child's developmental history, observations, direct interaction, and a parent interview. During the observation, evaluators will also look in the areas of sensory reactions, emotional output, and adaptive behaviors. What are the benefits of early identification and diagnosis? Children diagnosed early tend to have higher IQs, better communication, and increased socialization skills. So if you're a caregiver or in education, learn the signs of autism spectrum disorder and refer for screening and assessment as soon as possible.